Hello, this is Dr. Kulmeet Kundlas, and today we will be talking about Winter Illness 101, where we will discuss infectious and non infectious diseases, which are very critical and very important in seniors, and why it's important to talk about it now so that we could protect ourselves, and also what are the other measures we could take naturally to protect ourselves. Thank you for joining. My name is Dr. Kulmeet Kundlas, and I'm a primary care physician. Winter. Winter is for seniors not only physically challenging, it is physiologically also very challenging because it brings unique challenges for our seniors because of their physical increased demands and also physiologically because as we live we accumulate a lot of disease and disability over the period of time, and that makes us really vulnerable to multiple complications. In this talk, we will be discussing about winter illnesses into two broad categories. One will be infectious diseases, other will be non-infectious diseases. It is surprising to know that not only you are at high risk for common illnesses like flu, RSV, pneumonia, common colds, bronchitis, sore throat, we are at increased risk for developing heart attack and stroke, falling, depression, and whole host of other medical problems. And we will detach and explain everything about all of them, and that way we are able to come up with a practical strategy which will help us to take care of these things, and we are able to prevent these common problems. Let's start with seniors, why it is important for all of us to discuss this thing today, and why we worry very seriously about the senior in winters. Age weakens our immune system, which makes us at higher risk to develop very common preventable diseases. Unfortunately, the acceptance rate of different kind of vaccines in seniors, in spite of all efforts, it's not more than 50 to 65% depending on which kind of literature you look at it. So these common illnesses which are 100% preventable and nobody should die of these problems become a major problem. Second, seniors have accumulated multiple chronic medical problems, and the most important one are COPD, asthma, chronic bronchitis, diabetes, heart failure. All these problems, independent of your physiological state, put you at higher risk of developing these problems. Further, the subcutaneous fat in seniors is decreased. That kind of limits seniors to control their temperature. They become very sensitive to cold and heat, especially cold, and seniors who live in colder part of United States or colder part of the world are at high risk to develop any kind of medical problem out of poor thermal temperature regulation. Decreased mobility puts you at high risk for not clearing your secretions properly and increasing the risk of infections. Many seniors have poor circulation, their lung functions is declining, and above all, their nutritional status is compromised. They are not able to eat properly. They have a difficulty, with problem with transportation, number two, cooking. Then their mood and what it takes to be culturally eating, they tend to consume less. That leads to multiple nutritional deficiencies and leading to problems. Further, they have a lot of skin changes, reflux problem, and decreased muscle mass. Why this muscle mass is important in relation to senior illness in winter? Because muscle, no matter even your breathing also uses muscles, moving uses a muscle, your heart is a muscle. When the muscle size decreases, you are at a very high risk to develop any kind of complications. The condition of decreased muscle mass as we are aging is called sarcopenia. Above all, few of our seniors have decreased cognitive capabilities that makes it very hard to manage the diseases and to ask for help at a correct time, and also they have difficulty in understanding and picking up these symptoms quickly. Why we are talking now is the goal of this video is that if we could equip ourselves early enough in the winter, we still have a time to put all these measures together. That way, we could protect ourselves. Statistics are very convincing that during winters, seniors must pay attention. No matter whether we pick up infectious causes or non-infectious causes, you will find that 80% of the deaths related to winter, whether infectious or non-infectious, happen in seniors above the age of 65. So we need to prepare now, and we need to put all the processes together so that you are able to take care of yourself in a timely fashion so that you could take care of yourself. Before I go over all the individual diseases, I want to highlight certain things which is the core message which I want to convey during this video. Number one is the vaccines. I truly believe the vaccine rate is very poor. If vaccines are taken by all seniors, we will not have so many deaths. Number two, nutritional status. We must eat good all the time, but we must eat really good during winters. Number three, exercise. We must move. I understand few of us will not be able to go outside and do this one, but we must move in the house. Number four, we must have a very strong relationship with our primary care physicians. Unfortunately, you don't tell us and we do not know. Unfortunately, if there is no communication between our offices, we will not be able to help you. Also, make sure you call your primary care office and find out that they have telehealth services so they could see you if you can make it to their offices. Also, ask them whether they have walk-in slots, because if you develop some kind of a problem, you must have access to the care. Most of the seniors end up going to the urgent care centers, combined with their load of multiple medications plus burden of chronic medical problem. Those physicians do not fully understand you, and you end up getting a lot of unnecessary antibiotic, unnecessary medications, hospitalizations, emergency room, and multiple complications coming out of that. So the key point here is you must have access to care, and there are two parts to it. A, you should be proactive, asking for help. That's where educating you and your caregiver is very important. And then you must have a healthcare system which supports you. So points are vaccines, nutrition, exercise, access to care, and proper support system at home. Let's discuss infectious medical conditions which are common during winter seasons. We'll start with the simple stuff. The most common thing is common cold. Common colds is a rhinovirus infection, and they only involve the upper respiratory tract, your ear, nose, throat, larynx. They rarely go into your lower lung or lower respiratory tract, which includes your bronchi and your lung tissue alveoli. If it's only upper airway, that most of the time is due to rhinovirus. Very self-limiting disease, but it could be a big problem for the seniors. Yes, it is only upper respiratory tract. If you are not taking care of yourself, you are at high risk of developing super-headed infections or the infection going into your lower tract. At your age, you must not ignore, you must have access to care. But most of the time, it is a self-limiting disease. So long as your nutrition is good, you're moving, and you have a support system at home, you could manage it. Next viral infection is norovirus. Most of them will give you a lot of vomiting, diarrhea, stomach cramp and stuff. And usually it's very contagious. You will have everybody in the house will have a short burst of diarrhea in this one, but again, very self-limiting. Then some bacterial infections like streptococcus, strep throat, which we go by, that is very common. And this also, these bugs, once they go into lower tract, bronchitis is very common. But the diseases which kill senior are now. Number one, flu. Influenza affects about 3 to 10 to 12% of all the seniors per year. And it is number one cause of a reason of death, 65 and above. It's a simple innocuous disease. We don't pay much attention to it. And for some reason, a lot of seniors are very resistant to flu vaccine. They don't want to take it no matter how much you offer them. And they have multiple ways to explain it out, rationalize it out. I truly believe that is the biggest weapon we have is the flu vaccine. The flu vaccine should be given to you once a year, and it is best time is take it early in the winter. It will provoke enough immunity in your system, and you will be able to protect yourself. Side effects of this flu shot is a little bit of pain at the site of injection, a little redness, very occasionally fever and some soreness. But I never had anybody ever getting sick beyond that point. But a lot of seniors for some reason are very reluctant. But the best thing is we lose 30,000 seniors every year to flu only. And the flu or influenza not only kills you with the respiratory problems, God forbid if you have a heart problem, heart failure, it increases the risk of heart failure, dysarrhythmias, and whole host of multiple complications and hospitalizations. So you must accept the immunization. You have a right to ask the question, and you must do all due diligence, which we will be more than happy to provide you all the information. But please make sure you take flu shot. Then comes is most common question regarding flu shot is, what is the senior flu shot? As we started in the beginning, the immune system of seniors is compromised. You are more vulnerable to develop infections. The same reason, once we give you a vaccine, we are giving you some part of that virus which gets into your body, and your immune system is supposed to mount a reaction against it so that you could build immunity against it. If your immune system is compromised, you may not mount enough immune system or the protection against it to help you. So that's why in the senior flu shot, the content of this antigen, which we call it, or this attenuated virus particles, the concentration is high, so that we give higher concentration up front. Your body can mount a lot of reaction, and you could improve your health, and you have a good robust protection. Second disease is RSV. RSV starts exactly like a common cold, but this is a little bit more dangerous than your common cold. We get on an average for almost 200,000 hospitalizations annually due to RSV, and it is estimated that we lose about 14,000 seniors to RSV. But the beautiful part is we have RSV vaccine. This is a one time in life. Everybody above the age of 60 should have RSV virus vaccine, and you will be protected. And all insurances cover these vaccines. You do not need even a physician order. You could go to your pharmacy or you could come to your primary care office and they will give you this shot. This is a one shot, one time a deal. As we are talking today, once the guideline change, we will change. But remember, almost 200,000 hospitalizations. Average hospitalization cost in the United States about 7 to 10,000. And you do the math, how much loss of life and money is involved in this one. Third is the COVID-19. I don't think we have more polarization in the United States other than this topic. In spite of all the data, all the criticisms, all the negative press COVID vaccine has it is proven over and over that COVID vaccine protects you from getting COVID infection. No vaccine is 100% protective, but if it lowers your risk 70 to 80%, you will not find anything else in your life where you have 70 to 80% guarantee. Second, if God forbid you have the COVID injection and you get COVID, it's very mild. You never get sick to the point that you need to be hospitalized. And it protects with 80% certainty from you dying. I could understand all the criticism questions seniors had in the beginning, but now we have 3 to 4 year data. It is clearly very effective. Now, I don't think our government and we as healthcare community have done a very good job in conveying you the data so strongly and also convincing you why you should take the medication. COVID-19 is a very unique virus because it is mutating at a faster pace than other viruses which we talked about, like virus, norovirus, RSV, flu. This virus is changing or mutating at a fast. We did last week a video on the newer strain, which is Priola, Priola, which is also given a name BA 2.86. This virus has more mutations which the previously lethal variants like Omicron or Delta virus had. And you know how many people we lost in the United States from that. This virus has 30 mutations. Technically, this virus could be a lot more dangerous than the previous variants. The CDC is following it very closely. Scientists are following it very closely. So far, it's not declared of any special concern over and above what we know so far. But we must take the new COVID shot, and there has been a discussion also in some literature because this virus has so many mutations that you may need another booster. I think this is a place where we must talk. Don't consider COVID shot as one-time shot. COVID shot is going to be an ongoing vaccination, and we should put it into our schedule. What is happening is we think we get a flu one shot and then we are protected forever. Because the problem scientists are having is because this virus is so smart, it mutates at a very fast pace. Because it changes so quickly, to provide you with the immunity, they have to keep on coming with the boosters. And we must accept these boosters. There is a ton of safety data which has been published. And all the negative press, all those things, in spite of that, it is not substantiated. It is very clearly defined that COVID shots protect you from getting sick. It protects you getting sicker, and they protect you from dying and hospitalization. So these shots save money and life. They improve your lifespan and health span. Next infectious disease in winter is very common is pneumonias. Because we are in a closed environment, we are in a close contact. The bug Streptococcus pneumoniae, name is not important. The pneumonias are very common in winter, especially in seniors above the age of 65. Everybody above the age of 6 months to end of life must get this shot. There is this pneumonia shot protects you about up to 90%. Can we think of anything which can give us a 90% guarantee? There are about 18 to 20,000 seniors which die every year from this pneumonia. These infections ranging from common cold to stomach flu to strep throat, bronchitis, RSV, influenza, COVID, and pneumonia, all of them are preventable. This is the best time to be a senior because we have highly effective vaccines to prevent all of them. If you get yearly flu shot, you have taken your pneumonia shot, you take your RSV shot and your COVID shot, you are protected virtually from all winter illnesses. I don't think there was any generation before us which was more protected from this infectious pathology. If you look at it, significant increase in lifespan which has happened, that has not happened because of anything as a human we have done. It is directly related to childhood vaccinations and improved nutrition. We have eliminated so many childhood illnesses with these vaccines that we are enjoying to live long life which is full of quality, but we must protect ourselves during our vulnerable years. Now let's shift gears and check about non-infectious diseases. In winter, incidence and prevalence of anxiety and depression is very common because we don't have a problem in Florida, but rest of the United States does not get enough sun. And once we don't have enough daylight, the chemical chemistry in your brain changes, all the circadian rhythm changes, and you are at very high risk for anxiety and depression. It goes by the name SAD, seasonal affective disorders. Again, because of all those problems, you are at increased risk to develop, if you have asthma, more exacerbation of asthmas happen. Because of the same reason, more exacerbation of COPD happens. Then incidence of heart attack and stroke is a lot more in winter season because during those times your blood vessels goes into spasm or vasoconstriction, which can lead to. Because of the cold, you are at higher risk to develop arthritis. Your knees, your back, your shoulders, they hurt more. Your skin is more drier because in the colder part we need heat, the skin become dehydrated. So make sure you hydrate yourself properly. If we eat properly, exercise, and maintain our muscle mass, all of the non-infectious pathologies will not happen. See how beautiful it is now if we take care of ourselves with vaccines, we eat properly, and we exercise. Those are the things which we are supposed to do it anyway. My goal was to convince you that winter is both physically and physiologically very taxing for seniors, and you must do everything under the sun to protect it. The evidence lies that you must protect yourself with your vaccine, you must eat properly, and if you do all these measures, you will have smooth sailing. I hope I have made enough case that you must take flu shot, pneumonia shot, RSV shot, shingle shot, and anything which you need to keep you safe. Improve your nutrition, eat properly. I would appreciate if you could like, share, and subscribe to our channel. My name is Dr. Kulmeet Kundlas. I will, if you were comment or you have any questions on the discussion which we had today, I will be answering those questions in a timely fashion. I hope this video was helpful to you, and I will see you next week in a different session. Thank you very much.